Welcome to the Delaware County Township Association news update for the week of February 8th, 2021. I'm Michelle Gatchell, and I'm here with DCTA Ohio President Ryan Rivers, and our guest for this update is the Delaware Public Health District Health Commissioner, Shelia Hiddelson. Hey Sheila, thank you for joining us and giving us an update on where we stand in Delaware County with COVID vaccines.
So Delaware County is receiving vaccine about once a week. We're getting about 1,500 doses for the entire county. There are about 15 providers, so each of us are getting about 100. Boy, I said about a lot there, didn't I? Some weeks the health district does get a little bit more. So like this week, we're getting 300 doses. So that's good news. The bad news is it's just not nearly enough vaccine for everyone. As most people know, the only two vaccines that have currently been approved in the United States are the Pfizer vaccine and the Moderna vaccine. Great news. We're getting really great results, and the immunity that's built up after the two doses is really very good. It's up in the high 90s. It's just that there's just not enough. Now, we did hear this week that the Johnson & Johnson product is emergency use authorization. And that's good news because we understand from our state partners that as soon as that's released, we expect to get a lot more vaccine in the state of Ohio.
Wonderful. So where are we on the levels of people getting vaccines, ages, and things like that?
Currently in 1B, and 1B are persons 65 and older, people who work within the K through 12 system, and then people that have a congenital disability that are working with their boards of DD, developmental disabilities. They're all currently being vaccinated. There's another subset of people that have medical issues, like long-standing medical issues, that are also going to be in the 1B, B as in boy, but we don't know yet how the state is going to determine whether or not you're eligible to be in that tier. So that one's still kind of up in the air. We don't know what comes next yet here at the local health department level. We've asked that question. What about the rest of our first responders? What about that important infrastructure that we all need, like our people who take care of sewer and water and trash and all of that? But as of right now, we don't know where those people fall in the state of Ohio.
How are we trending? Is it a positive result so far that we're seeing?
So we are seeing a decrease in cases, and that's good news. The other really good news is that in our region, we're starting to see less hospital admissions, so that's good. We were under 300 in the last couple of, under 300 COVID admissions in our entire region in the last couple of days, and that's the first time we've been that low in a long time. When I received our regional report this week, we had over 100 intensive care unit beds available, and it's the first time we've been over 100 in quite a while too. So we look like as a state that we're trending in the right direction. We are starting to get people immunized, although it's still small numbers. The main thing though, I think we all have to remember is we're not out of the woods. So we really truly cannot let down our guard. We still need to wear our masks. We still need to try to socially distance, good respiratory and hand etiquette, and really all of us need to continue to kind of stay on our guard.
How do people register for this?
So that's the other thing I think that's been a little bit difficult because we have 15 providers in the county that are getting vaccine, even though for us in Delaware County, there's 15 different places, but there are just a few. So Kroger has been getting some, Giant Eagle, the health district, Ohio Health has received some. But because of that, people have to go register at all those different places. And each of those places are doing those same tiers. So I will tell you, like the public providers, like the Kroger, Giant Eagle, our Meijer isn't getting any, but some Meijers are. They are really focusing on that 65 and older population. We at the health district are focusing on that 65 and older population, but we're also working with our boards of DD to be able to get that group vaccinated. And then of course the K through 12. You may have heard this last weekend, we were able to do almost 4,000 staff in that K through 12 group, which is great news. We know that our governor wants to get these kids all back to school full time as quickly as possible. I think the difficult thing is we didn't get 4,000 doses that we could give to the 65 plus group. And so there is a lot of concern and angst and honestly anger at why are we vaccinating young, healthy teachers, which we all understand it's to get the kids back in school, but then we don't have extra vaccine to give to the 65 and older population. So it's been really hard, I think, this week for people to understand that. What our message and what we want them to know is if we receive 4,000 vaccines and we could just give it any way we wanted to, we would absolutely do that and make sure we stayed within those tiers. Unfortunately, when we were given that amount, we were told you are getting this amount for your K through 12. If you're not going to do your K through 12, you're not going to get that vaccine.
Sheila, how do you see spring's right around the corner? Obviously, sports, summer events, fair. As far as an assessment and a timeline, if we continue to trend in a positive way, what is the outlook?
So I think that's a great question, Ryan. One of the things we've actually asked recently of our partners down at the Ohio Department of Health is, when are they going to start revisiting some of those guidelines? Because as you know, some of those guidelines came out almost a year ago. And so we have seen a lot of things. We've also learned a lot of things in the last year. And so really looking at those guidelines, figuring out what's still relevant, what isn't relevant. For example, I know you and I worked on swimming pools last year, and one of the things with swimming pools was you had to have someone who could go in and wipe everything down every so often. Well, since that time, we've learned that that fomite transmission, that's what that's called, is not the way that this disease is primarily being spread. So asking someone every hour to go around and wipe things down when that's not the primary transmission rate doesn't really make a lot of sense. So within our Restart Ohio group, our team that's working on this, they've started kind of looking at all of those orders and started to ask people, send us your plans. And in light of all the orders that we currently have, we're going to let you know how you could do that, operate safely without breaking any laws or rules or guidance, depends on where you fall as whether you think they're rules, laws, or guidance. But we're going to try to help you to do what it is you want to do in the safest manner possible. But we don't have any firm guidance yet that tells us, yes, you can do this, no, you don't have to do this.
So Sheila, we want to thank you so much for joining us and giving us this COVID update. Tell everybody one more time the website they can go to sign up for vaccinations.
So for the Delaware General Health District, right now what you can do is you can go to our delawarehealth.org. The very first thing that pops up is our vaccine page. You can go on there and register to be on our waiting list. When then we have enough vaccine, we will send you a link to actually schedule an appointment. Right now, we're scheduled out almost till the end of March. We have about 7,700 people already scheduled for appointments. Remember, I said we're getting between 100 and 300 a week, so that's going to take us a while. As soon as we find out that we get more vaccine, we're opening up more appointments. And then we have over 10,000 people that are on the waiting list that just want us to send them a link so that they can get an appointment. But we're holding off on doing that until we know we're going to have vaccine, because we definitely don't want to cancel appointments.
Right. Ryan, Sheila, thank you again for this Delaware County Township Association COVID update.
Thank you for asking.
Thank you.